whole thought of having OrthoTrends stems from the fact that there is so much of rapid expansion and rapid innovation happening in the space of orthopedics. It is important that we bring those cutting technologies, new generation implants, robotics, all the new designs, approaches that internationally and nationally we have surgeons.
And I think this is going to be a game changer. We hope to have a lot of interaction with the delegates, and I do believe that meetings of this nature are critically important for dissemination of infection, because it gives an open platform to a lot of people who are participating and who are coming in as faculty, giving a chance for everybody to interact, debate, discuss, and learn from each other.
It's a structured learning process, and they all have to learn properly before getting into that, the difficult approach. So you just mentioned to us, what are the advantages of the specialized table rather than a standard table, which the other people will explain.
All right, so it's not a trade-off. It's just I have access to the table. One, the fact that what that table does, it reduces the number of assistants. It reduces the variables in terms of pulling and tugging of the leg. So there is a continuous force. The table is hydraulic in nature, so it helps in extension, external rotation in a more predictable manner.
Yeah, I think the role of OrthoTrends is to combine surgeons who have a passion and desire to learn about arthroplasty, to introduce new tips and tricks and novel techniques that advance everyone's practice and help patients all over the world.
The conference like this brings together a lot of surgeons from abroad, come and actually share their knowledge with us. And with time, this has only improved, and we've only become better in learning and also updating ourselves and sharing our knowledge.
So this has been a fantastic conference of 1.5 days. We have covered everything from primary replacement to revision surgeries, and we have included robotic and innovations this year also. And in robotic, we have conducted a workshop of robotic partial knee replacement, which is the first of its kind in the country.
So that was the pre-operative X-ray of the same patient, and that was the post-operative one where the tibia is in a bit of varus, and that's the overall alignment of the limb, slightly medial to the center.
Sometimes they have a huge ossified loose body behind the PCL also. It just opens up. How often you will change the poly?
Anything between 20 to 25% cases, yes.
So what is your threshold for PCL tension?
For PCL tension?
Yeah, in terms of the slope.
So the first question about the slope, sir. So we know that sometimes we also give flexion to the femoral implant, and then the tibial slope is also there. So in sciatal pain, usually I try to keep the combined flexion not more than 10 degree.
This is a combination, it's a collaboration, and it's crossing boundaries where there are a lot of boundaries, especially around medicine. So it is an international meeting, but it's combining the international technologies, so we're working together.
So it's a good event in itself, where the seniors can easily not just deliver lectures but discuss various nuances of surgeries and things that can go wrong during surgery, to give the newer surgeons and upcoming surgeons a confidence of doing these complex surgeries. So along with the use of technology, conventional systems, and the good results we are seeing with the newer systems, it's indeed been a good conference to attend.
Clearly, CT scans, etc. are required so that you know what the lay is of the bone. Also, these are the kind of cases where if you're going to lengthen it, which just needs significant lengthening, you do the adductor tenotomy prior to the positioning.
One must follow the protocol of CT scan, which gives a couple of ideas, very important ideas.
Essentially, when you talk about bisphosphonates, which I will be speaking about, it is repurposing the bisphosphonate drugs. These are the process of finding new therapeutic uses for existing drugs.
Custom available implant, you can put it in. This is again one of the cases. A 54-year-old female with a bipolar, that's what we made, handmade. And this is the ease. Whenever you put all these cements, the ease is that you just knock off the shoulder, you have put it in, somebody can just hold it, and most of the times you're just able to pull it out. That is how easy it becomes.
If I'm from a small place, I would only know treatment options that are available to me. But sitting here listening to people from all over the world, you get to know that there are multiple options that might not be available in your city, but these are there, and in future you can use all of them. So I think that's a good takeaway point from the conference.
Just getting experiences from a different point of view, especially from Indian surgeons, much more complex cases in India than we typically see in the United States. And so just watching to see how surgeons deal with those complexities and those difficulties and making the most of what they have available to them from a scientific standpoint.
We are not here to test somebody's competency. Your views, experience, evidence-based opinion will share to delegates.
So this kind of conference helps the new and young arthroplasty surgeons to keep up with the new things that are coming up in the science. It also helps you, get to know the latest advances in the technology, latest advances in the surgical techniques, and also gives you a good case example on handling the difficult cases which you might come across in your own practice.
Last year, India did 300,000 knee replacement. Presently, we are number 2 in joint replacement after USA in the world. Very soon, in coming 5 years, we'll cross USA and become number 1 in joint replacement in the world.
In your country, how long do you give IV antibiotics when you are retaining an implant?
6 weeks typically.
You go ahead with central line, or you want to?
Peripheral inserted.
My opinion, nutritional assessment of patient is very important. And serum proteins and serum vitamin D3 level is very important before you start the surgery or think about surgery.
I'd really like to appreciate the team OrthoTrends and Shalby team. It's a wonderful crowd, wonderful faculty, and great curation of talks and real-life surgeries. And I was happy to be part of the robotics session. And there was a lot of interaction with the delegates as well as the faculty on stage. So keep it up. I'm looking forward to being here next year as well.